So Wendy is a patient at Brandle Surgery, and I was fortunate enough to be the first port of call once she had a diagnosis of type 2 diabetes.
Do you want to come through?
You're right. Yeah, sit in the big chair. Because we're only a small practice, we do know our patients really well, and I do believe that continuity of care is really useful in managing type 2 diabetes.
You know, we go through everything. It's all about you making the choices, isn't it, and informed decisions.
I used to see her once a month, just to get checked, weighed and measured and see how everything was going. And then I think it's every 3 months I was having blood tests, and that's how we go on.
Your diabetes history now, even though you're in remission, we want to keep your blood vessels nice and healthy and not full of fatty deposits.
Yeah, she's been a really strong part of my journey with diabetes.
I know from experience that when you tell somebody they've got a lifelong condition, a long-term condition that's not going to go away, a lot of that initial consultation they probably won't absorb and digest, and some people feel really, really shocked by the fact that they've got a diagnosis of type 2 diabetes. Always reinforce it's their diabetes management. I'm there to support them in whatever way I can, but what I try and encourage them is to take ownership of this diagnosis and try and encourage them to make their own clinical decisions, making it a two-way conversation so that the patient's making the final decision.
It's amazing because it's literally probably 3/4 of a mile away from me. So I know that at any time I can give her a ring and just go down and see her.
With a regular touch base, just a 10-minute check-in once a month. We weighed her, we checked her abdominal circumference, and she could see by what she was doing with diet, activity, and that change in her attitude to her diabetes and health in general was having an impact, because she was losing weight and losing inches from round her waist.
So I couldn't really ask any more of you. You've actually driven this yourself now.
I've got to, haven't I? Only I can do it.
You were driving this beautifully.